Hi all, how are you all? Let's start Anesthesia INICET 2024 paper. First question, this is the repeated question. Yes, the questions on the ACLS, BCLS, emergency care support, everything is important. Which of the following are the components of high quality cardiopulmonary resuscitation in adults? Okay, first thing is chest compression should be given at a rate of 100 to 120 per minute is correct. The depth of compression should be 3 to 4 centimeter. We are thinking about 5 centimeter. Okay, let's see. Compression is to breath given should be in the ratio of 30:2. Should allow for a complete recoil of chest. So 4 is obviously correct. Yes. 1 is correct. Yes, 4 is correct. 1 is correct. Is only option B. Hence, option 2 they have considered it as a wrong. Understood? How did I come to know? See, I know first one is obviously correct and fourth one is obviously correct. So only options with B has both 1 and 4. So they are taking 2 as wrong because we have learned that depth of the compression should be 5 centimeter. Okay, let's see the explanation. This actually have repeated many times. Okay, 2020 repeat and also 23 repeat. The effective chest compression in adults. It is provide 100 to 120 compressions per minute, that is 30 compression every 15 seconds. You have to give at least 30 compressions. That is same for child older than 1 year and also up to puberty. Whereas infants less than 1 year also you have to give same compression. But the difference is how to hold your hand. That is, in adults, place the arm one over the other in the midline on the lower one third of the patient's sternum and lock your arm. But in children up to puberty, here you have to hold one or both the arms placed in the midline. Okay, but in infants, when two providers are present, then you can place the two fingers, one between the nipple line and other 1 centimeter below it. Okay, two fingers. Whereas when two providers are there, then you can encircle the infant's torso with both the hands, with both thumbs pointing cephalic positioned 1 centimeter below the nipple over the sternum. So depth is almost similar. Okay, so use both the arms to press the chest to the depth of at least 5 centimeter. But in question they have given 3 to 4 centimeter. That is actually a inadequate depth. So the blood will not push till the brain. Okay, when you compress, the blood should go from heart to brain, then to other parts. But here it will not go if you don't press the chest to the depth of 5 centimeter. At least 5 centimeter, 5 to 6 centimeter is okay, or more. Okay, press hard and fast, so that you have to press very fast. That means every 15 seconds how much compression? 30 compression. Allow the full chest recoil for every compression. You should allow full recoil of the chest. In children, the depth of compression is 2 centimeter. Press hard and fast and allow full chest recoil for every compression. That is correct. And here, in less than 1 year baby, the depth of compression should be 1.5 inches. Okay, here the 2 inches. Press hard and fast. Allow full chest recoil for every compression. Compression to ventilation ratio. In absence of advanced airway, 30 is to 2 compression. Okay, if advanced airway is present, that is endotracheal tube, supraglottic airway, then you can give 10 breaths per minute. Okay, this was asked in our previous question. Okay, here they have asked which of the following are good. Okay, that means the second one is wrong, so answer is B. Ambu Aura 40 is an example of. Ambu Aura 40 is a supraglottic laryngeal airway. But which generation? It comes in generation 1. Let me show you. See, supraglottic airway devices, there are first generation, second generation, which we usually see. Okay, third generation and fourth generation are not a standard classification. They are in the development. Okay, so let's not take third and fourth generation now. Let's see the first generation and second generation. First generation, main thing you have to see is drain tube. See, here there is only one tube, here also one tube. That is the first generation. This is the easy way to identify. Okay. Second generation will have some safety features, that is drain tube. See, this is the main tube and this is the drain tube. So here also you can see two tubes are present. Here also there is two tubes. Okay. Then in this also you can see two tubes are present. If there is two tubes, that is, one is drain tube, another one is for the ventilation, that is a second generation. Okay. The first generation seal around the glottis, okay, but lacks additional safety. What are the example? There is flexible laryngeal mask airway, and you can see laryngeal mask airway classic. This is the classic. This is the superior part. It rests on the base of the tongue, whereas lateral wall of the piriform fossa, whereas this tip is above the esophageal sphincter. This is the Ambu 40. This is the Ambu 40A. Okay, Ambu 40 is this one. Whereas let me show you. This is the Ambu gain. Other example is intubating LMA. Coming to the second generation. This have additional features and safety and functionally it's very nice. Okay. Example is Ambu gain, LMA Prosil, iGel and LMA Supreme. Okay, this is the LMA Supreme. See, it's a very special thing and all is present. This is the Supreme one. Okay, LMA Supreme, iGel, Ambu gain. This is LMA Prosil. You can see the drain tube here. Why I am stressing on the example is because they will ask the example. It's very important in both NEET and INI. Okay, so please know the examples of LMA generation 1 and generation 2. Hence, here LMA or 40 is a generation 1. Why 40? 40 means it can be used 40 times. Okay, reused 40 times. Which of the following drug causes adrenal suppression? Let's see. In the given option, etomidate causes adrenal suppression, which can last for 72 hours. Why? It inhibits 11 beta hydroxylase, which decreases the biosynthesis of cortisol and mineralocorticoids. Hence, it will causes adrenal suppression. Okay. Why it causes adrenal suppression? Because it inhibits 11 beta hydroxylase. Okay. Now, other options they have given, thiopental is for sedation and hypnosis, whereas ketamine stimulates the adrenal catecholamines, they will not depress. Okay, propofol is CNS depression without direct impact on adrenal hormone synthesis. Okay, hence here option is ETO. ETO causes adrenal suppression. Okay. Fourth one, a female following a RTA injured her chest on X-ray. A fracture of 3 to 5th rib was noted. The pain was not responsive to analgesics. Which block will be given to reduce the pain? Can you guess this? This is the easy question. Which block we have to give? It is a ribs. Ribs are attached to thoracic vertebra. So thoracic epidural block is given. That is the segmental anesthesia. The thoracic epidural block provides anesthesia to thoracic dermatomes and surrounding structure that will help in reducing the pain and improve respiratory function. So when there is more pain, it's very difficult for you to breathe, isn't it? So if we give this thoracic dermatome is blocked, it will help to reduce the pain, hence patient will have a good respiration. Thoracic epidural block is used in post-operative pain relief, chronic pain syndrome, that is in post-herpetic neuralgia, and also RTA, where they have given the analgesics but it is not responding to the analgesics. Hence, we are giving thoracic epidural block.